So whenever we talk about feline respiratory illness and most of these viruses, you keep probably seeing supportive care. So number one, you're gonna do, and I'm right here on the notes. So supportive care, which supportive care is just good, that kind of also entails good nursing care, making sure they're eating, do they have water? Antibiotics, because anytime they're fighting a virus, they can get a secondary infection. So typically, and again, antibiotics aren't treating the virus, they're just supporting the immune system to help fight bacterial infections. One of the blanks should say force feedings. Again, anytime a cat is potentially congested and not eating, we may have to force feed. Now, force feeding could be literally trying to put a little bit of food in their mouth and hold it shut. That doesn't tend to go well. But you may have to pass what's called a feeding tube. You can do what's called a nasogastric or a nasoesophageal tube. And you can do this on awake cats. We numb the nasal cavity and we pass the tube. And then we usually give them a liquefied diet. Now, it can be something liquid. There's stuff called Clinicare. You may have talked about it in nutrition. And it is literally kind of like liquid nutrition, which is made for feeding tubes or bottles or syringe feedings. But you can also take a canned diet and mix it with enough water in a blender to make it very, very thin. Again, nasal feeding tubes in cats, they have a very small nose, and the tube lumen or diameter is not going to be very big. So again, it has to be pretty liquid enough. The other blank here should say oxygen therapy. Now, oxygen therapy is only if they're dyspneic, and dyspneic is if they're having difficulty breathing. So, they could have a significant enough infection where, you may need to check a pulse ox, you might need to check their oxygen levels. And oxygen therapy, like at VCA, we have oxygen cages in the ER. You could do oxygen via a nose cone, which is temporary. We can put in nasal oxygen and hook them up to an oxygen line. So there's different ways to do oxygen treatment. Another treatment is actually disinfect environment. So again, that's kind of prevention, but it is also, you want to make sure that we're kind of taking care of the environment. The other blank on here is fluid therapy. That kind of could go under supportive care. But like on a test, if I say, how do you treat this? I don't want you to just write supportive care. I want you to know what that means. And supportive care is, maybe keeping them warm, giving them fluids. I am kind of spelling out some supportive care, but IV fluids, because if they can't smell, and sometimes, and also if these viruses are causing oral ulcers, they may not want to eat because their mouth hurts, and therefore they may not want to drink. So you might need to do IV fluids. Also, this line here, this next blank would be clean eyes or nose. So usually when they're hospitalized, you want to try to take away some of the mucus, mostly from the nose so they can smell and they can breathe, but also to keep their eyes clear and comfortable. Now, there is a supplement called lysine, and lysine, now that doesn't kill the virus, but it can inhibit or interfere with virus replication. Lysine is best in early stages, if you catch it early. Once the virus has already begun to replicate, it's not as helpful. But what will happen is if you catch it early and you start them on lysine, you can actually prevent it from becoming a worsening illness. So again, it's not killing the virus, but it's somewhat inhibiting its replication. Therefore, they don't have as much virus. The body will fight it off easier, is the theory. Lysine can be somewhat expensive. And again, it kind of depends on the stage of the illness, whether you're going to use lysine or not. Now, the prognosis for the viral rhinotracheotis, it has low mortality. They will eventually get better. The younger they are or the older they are, especially if they have another illness. Like if you have an old cat with renal disease and it's exposed to a kitten, it's going to be harder to fight off the disease. So if they're older with concurrent disease, or if they're very, very young, they can potentially have mortality with this, especially if it progresses to respiratory difficulty. If it affects the respiratory system to that degree, it's going to be worse. Now, the calicivirus has a lower mortality, but it can develop into a more severe form, survivable. Like I said, when I hear calicivirus, I think mouth sores. And when they get these mouth sores, and it can also affect the gum tissue. So sometimes really bad gingivitis, mouth sores, and it causes something called stomatitis, which is inflammation of the tissues in the mouth, gums, lips, the mucosa. And again, they sometimes are drooling because I don't know if you've ever had such a sore throat or your mouth hurt, you didn't want to swallow your saliva. I know that sounds kind of strange, but I think, what happens is they just get this drool. And then also when you try to clean them, their mouth hurts. And so it just can make them feel really, really crummy when they have their mouth sores. So to prevent, vaccines is the best way, is just to prevent this from happening. So the feline calicivirus vaccine, it doesn't cross protect against all strains, but it should give some protection. So FER and FCV are typically part of the core vaccine group that they should get. We usually vaccinate kittens with at least 3 doses at 2 to 3 weeks apart, and hopefully that's what you learned in your vaccine when you guys already talked about vaccines. But usually, okay, thank you, because I was like, that's pretty standard, is usually 6 to 8 weeks, because that's when maternal immunity wears off. So we always assume they have some maternal immunity. So, and then we do 2 to 3 week intervals. And you usually want to try to get 3 doses, and then it's yearly. After that, we usually recommend a yearly vaccine. Sometimes cats can be done every 3 years. And I will say sometimes people, and I was even guilty of this, my cats were not outdoor cats. So they had their vaccines when they were younger, and sometimes adult cats aren't vaccinated, and they really should be. But I wasn't usually taking them to boarding facilities, and I wasn't taking them, they would maybe get in the window, because the theory is, even if you have an indoor cat, if you open your windows and they're in the window and then a stray cat comes, a lot of these viruses we're talking about, direct contact, and that could be through a screen. I mean, respiratory droplets go through a screen. Nose-to-nose contact can be through a screen. So in theory, even if they're indoor, they really should have these vaccines. Now, again, the traditional vaccine that we give doesn't protect against infection, but it prevents it from getting worse. For example, I don't know if anybody's gotten the coronavirus yet, or the vaccine, but what they've said about these corona vaccines that we are getting, it's not necessarily going to prevent me from getting it, but if I do get coronavirus, it should prevent me from getting severely ill or dying from coronavirus. And that's why they're trying to get people to get the corona vaccines. So it's a similar theory, is that if the cat's exposed, theoretically, it should give some pretty strong protection, but they could get a milder form. And so again, that's kind of, real world in the news. That's what's going on right now with these vaccines for coronavirus. And obviously you guys know the difference, MLV, modified live versus killed. The modified live has the fewer side effects. The killed has a slower onset, but it does give you better protection. Anytime you use a killed vaccine, you're giving a little bit of the virus. Um, so it does usually boost a bigger immune response. There is a nasal form, flip my notes over here, that the mom's immunity doesn't typically interfere, and it is a little bit better against preventing infections because you are giving the vaccine in the nasal cavity where the virus attacks. So by giving it via that route, you do get better protection. But I think the standard is usually giving um, the injectable. The recombinant vaccines are the ones that we potentially are seeing the sarcomas with. They are a killed vaccine, but those are the ones that have the higher risk of the vaccine-induced sarcoma. And the vaccine-induced sarcoma, it's not super common. It's just something to be aware of and watch when your cats get the vaccine. So you can sometimes, after the vaccine, there can be some sneezing and discharge because it's mimicking what happens when they actually catch the virus and they're building the immunity from that. I would just tell the owners, if it continues for more than a day or two, let us know. If they're not eating, let us know. If they're swelling, let us know. It should go away pretty quickly after the vaccine. Okay, so panleukopenia, feline panleukopenia, this is also one of the core vaccines that cats should get. And it is part of the parvo group, and it is very closely related to canine parvo. In fact, if you suspect panleukopenia in a cat, you can use a canine parvo snap test. We don't see, I want to say over my course of ER and clinic work, I've probably only seen a couple panleuk cases. It's, you know, it is highly contagious, but it's not super prevalent. But in those cases, we were able to use, so we don't have a panleuk snap test, but it is sensitive. The canine test will be positive if they're positive for panleukopenia. And you do the swab in the rectum with the cat just like you do the dog. So you run the test the same way. But it is extremely contagious, especially outdoor and wild cats. Can also be, you know, raccoons if they can come into contact with the feces or the excretions from a house cat, wild cat. But we tend to see this more in young kittens. It's very rare in adult cats, so it affects young kittens. It can be inactivated with bleach. So nice for the fact, so that blank right there should be bleach. The nice thing, it is easily killed. So it doesn't, I mean, it's very contagious, but very easy to disinfect for it. So the common transmission, most common, is fecal to oral. So anything feces gets on, they step in feces, or if feces is in a cage. So it can also be spread by oronasal secretion, so direct nose-to-nose contact or aerosolized particles on a fomite. So again, nasal secretions on a fomite, fecal secretions. It is also shed mostly in body fluids, but more especially in the feces. So that blank right there should see feces. So the incubation, it can be a few days to a week if they're exposed. It'll take 2 days to a week for them to show clinical signs. And the big clinical signs are gastroenteritis. So you have vomiting and diarrhea, and kind of like parvo, the cat that I remember this to this day, this kitten that they got from a shelter, the people adopted 2 kittens. One died at home, and then the second one started vomiting and having diarrhea. So the guy was like, that's what the last kitten did, except the last kitten died. So of course we were right away and thinking, something contagious, and they got from the same shelter. They were litter mates. And then when the cat had diarrhea, it was a very paley, pasty, with some flecks of blood. It kind of like how I explained parvo is diarrhea, but a very different looking diarrhea. Panleukopenia is the same way. It's a strange, paley, weird smelling diarrhea. And obviously, anytime you have gastroenteritis, vomiting, diarrhea, dehydration follows, and the mortality, if they're an older cat from a shelter exposed, they can handle it, but the young kittens are the ones that are more susceptible to dying from this, because the smaller they are, they don't have the body reserves. When they have vomiting, diarrhea, dehydration, an older cat has stores, like has fat and has built up nutritional stores within their body. When they're younger, they don't have that to the same degree. So mortality is going to be worse. Usually clinical signs are going to be the number one way to diagnose it, especially if they have a history of being with a lot of kittens. If they're in the history, there's, like when this owner said, oh, my other kitten died, now this one is sick, it's like ding, 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 because it's spread through litters, it's spread in shelters, catteries. But panleukopenia, all of the white blood cells are low because it attacks the white blood cells. So when they have an overall, what we call leukopenia, is where all the white blood cells are too low. If the count's under 2,000, which is extremely low, that has a very poor prognosis, because you need white blood cells to fight off everyday things. When you're that leukopenic, the bone marrow can't keep up and keep trying to produce white blood cells that fast. And that is an indicator of a more advanced form of panleukopenia. Obviously, whenever you should make this mental connection. When you have vomiting and diarrhea and dehydration, it can throw off your electrolytes. Electrolytes are sodium, potassium, chloride, calcium, and fluid balance is key. That's why when we give IV fluids, most very common IV fluids contain sodium, potassium, chloride, some contain lactate. But your everyday fluids basically replace electrolytes. So usually going to do an electrolyte panel. Now, the serology test, you can do a blood test, send off the serum. But again, if you have a canine parvo test in the hospital, that can be enough, because you can get that answer in 10 minutes. Serology, you're going to have to send it to the lab, and that might take 2 or 3 days. You can't wait for the test result. These cats are going to get really, really sick really fast. So you're going to kind of either have to assume or use a parvo test to definitively say it's panleuk. And again, prognosis can be guarded if they're adults, but they can fight it. It is poor typically when they're young. And in kittens, it can be 50 to 90% mortality. That means if you have 4 cats, 2 or 3 are almost going to die every time. That's a pretty high mortality rate for this. Treatment, again, you're not doing anything for the virus. So here the lines should be IV fluids. You have to keep them hydrated. You may have to force feed. Now, let me tell you something about force feeding, and you can do this in parvo puppies or panleuk cats. But if you have an animal that's vomiting repeatedly, you're not force feeding that cat. You can't really try to attempt force feedings until they stop vomiting. So the problem is if they're actively vomiting, don't force feed them, because when you try to put food in their stomach, they're going to just vomit it up. And then this is the problem when owners try to feed their animals that have been vomiting at home. They're like, oh, he ate. Oh, he looks like he's hungry. And they overfeed and they start the vomiting all over again. You got to rest the gut and then attempt to feed. Now, typically the third line, usually they'll add antiemetics, so like Serenia, anti-nausea medications to try to calm the gut. And the fourth line would be antibiotics. So usually because the intestinal lining is so inflamed, they're very prone to secondary infections. You need to give them antibiotics. And again, the antibiotics aren't fighting the panleuk, they are fighting the bacteria that want to kind of take advantage of the cat. And again, so nursing, I just want you to know, good nursing supportive care. Supportive care is feeding, fluids, antibiotics, potentially pain meds if it applies to that situation. The prevention is, vaccines, because the vaccines have almost completely eradicated. Like canine parvo is much more prevalent than feline panleukopenia. But I'll give you an example. That guy, the case I told you where the guy brought the one kitten died and he brought another. This was the Zionsville animal control or Zionsville animal shelter at the time. This was a long time ago, but they basically had gotten other reports of sick cats. They basically shut down their cat ward. Some died, some had to be euthanized, but they basically I want to say it was like 2 or 4 weeks, they were not accepting any cats at the shelter because they knew the environment, it had to be disinfected, it had to be cleaned, and they kind of needed it to settle. So they just went for a period of time where you couldn't adopt, you couldn't drop off a cat because this infection was so rampant. So now for the vaccines, what we have here is, and the other thing I should say, if a cat recovers from the virus, they're going to have pretty good immunity. Now, you might have an owner that now decides, well, do they need the vaccine? Do they have immunity? You could assume they might not need it because they should have a pretty decent immunity from having the disease. Usually we always it's not going to hurt them to come in and get the vaccine. And a lot of times you can't really take panleuk out of the vaccine. So if they're coming for the upper respiratory vaccine, the panleukopenia, is going to be part of that vaccine. So they're probably going to get it anyway. Kind of what people are doing in human medicine, and I don't know if you've talked about this in your other class, is some people are like, can we do titers? Can we check for immunity? Do we need to give vaccines? And I think that's done a lot more in human medicine. This antibody testing in animals, the test can be fairly expensive. Like if you wanted to draw blood, say your dog hasn't had a rabies shot for 2 years or whatever, you could theoretically try to draw blood and see how many antibodies do they still have from the last time they got the shot. We sometimes recommend this in dogs if they have an if they're immunosuppressed. And sometimes those animals, we don't want to give them vaccines, but the owner needs to prove that their animal is protected because they want to board them or whatnot. You could theoretically draw blood and test for titers for these diseases to see what is their rabies titer, what's their distemper titer, what's their panleuk titer. It's just fairly expensive. And so most people are like, it's just cheaper to give the vaccine than to try and do the blood tests to prove. But if someone had to prove it, if they didn't want to vaccinate, they could do antibody titers to see what level of immunity their animal has from like previous vaccines or previous illness. Kind of what they're studying with the coronavirus right now is they're trying to figure out how long are people protected if they've had coronavirus or if they have the vaccine. Well, the problem is the disease has only been here a year, so you can only test, and the vaccine's only been available a certain amount of time. So that's the problem, is they're still building data. We don't have all the answers yet. So any questions about panleukopenia? And what's interesting when you look at that name, pan is the whole body, leuk is white, and penia is low. So it causes an overall leukopenia. Panleukopenia is literally what it means, but it is diarrhea. Bad, 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 bad diarrhea. Now, there is also FIP, which is feline infectious peritonitis. So peritonitis affects what? When you hear the word peritonitis, what do you think? Where is the peritoneum? You were like, I didn't want to get anatomy questions today. Thank you. The abdominal cavity. So this virus affects the abdominal cavity. That's just what we think of infectious peritonitis. Now, it is technically a form of a coronavirus. So it originates from a corona. Now, we are not getting FIP from the coronavirus we're fighting, but coronaviruses are like a group of viruses, so they do different things. But this one will change into an organism. It's very, very hard to kill, but it takes a lot of virus to cause severe illness. This is another one that I've definitely seen cases of this, not that I feel like I've seen a ton. I feel like I've seen a ton of upper respiratory infections, but panleuk, FIP, but when they do get it, it's pretty sick, or they can get pretty sick. Now, it is killed by some normal disinfectant. So even though it's hardy, it lives in the environment well. In a clinic, it can be, your normal disinfectants like trifectant and stuff. And the nice thing is nobody ever really looks. I mean, I don't know if you've ever decided to look at a trifectant label, but a lot of times, like on the side of a Lysol wipes, it'll tell you what common viruses or bacteria it kills. So if you look up trifectant, if you look up, we used to use something called Rocal that looked like dark green. It was almost like syrup. You had to dilute it out. But the side of the bottle will typically tell you it works against this group of viruses, this group. But it's generally 6 months to 2 years old. Middle age, not so much, but I feel like when I've seen this the most is when they're older. For some, again, it kind of builds young animals, and then for some reason it drops off in the middle, but then we can see it when they're older. So domestic and wild cats, so outdoor cats, domesticated cats, if they are positive for FIP, most of them are going to be positive for a coronavirus, because if it's FIP, that's where it comes from. So if you're testing for coronaviruses, they're usually going to be positive for that as well, because that's where it originates from. So as far as transmission, it is shed in the feces, urine, and saliva. So multiple different routes of transmission. The mode is not clear, so it can be fecal oral. It can be aerosolized by sneezing or coughing. Transplacental, so the mother can spread it to the kittens. But the most common route of transmission is just close contact. So obviously when cats are together, I mean, I feel like anytime we had an FIP cat, we were like, we got to keep it away from other cats. We got to get it in isolation. If it's if it's in a home with other cats and maybe the others haven't gotten it yet, it could actually, we would recommend potentially having the FIP cat in a separate area of the house to prevent that direct. So with direct contact, Saliva or respiratory droplets are going to be very common because they meet nose to nose. They groom, they lick each other. Um, and now there are two types of FIP. There is a wet FIP and a dry FIP. So these two blanks right here, wet FIP, dry FIP. So initial illness, again, this is something that has to build. They need a certain level of virus for it to cause illness. So they may not show any outward signs initially. So they might show mild signs of inflammation. So that blank right here should say inflammation. Now, inflammation means they could potentially have swelling. They could potentially have achiness because inflammation of the joints, inflammation of the muscles, inflammation of the tissues. And some cats, they will show signs of, this last blank here is ocular lesions or neurologic symptoms. So this actually, I don't know if you guys have talked about this, but an opacity. So if you look at the eye, the surface of the eye should be nice and clear, almost like a very clear chamber, and then you see the eye. If an animal has ocular opacities, it's like cloudy spots. So on the eye, they look almost like it looks like on the surface. It can look like white spots, but if they have these opacities, and that just means there's areas of the eye that are not clear. So they're usually kind of milky, chalky, white little spots. And then obviously neurologic symptoms. It could be, neurologic is they're stumbling. Are they mentally inappropriate? Do they look, it could be stuporous. That's what I think of when an animal has neurologic symptoms. Because a normal nervous system controls the animal. An abnormal nervous system doesn't control the muscles well, doesn't control how they respond well, and that's what I would think of. Now, when we talk about the wet form, it's called effusive. If you remember, in anatomy, I talked about when fluid builds up in a cavity, like when you get fluid in the abdomen, that is called peritoneal effusion. Effusion is when cells and fluids move into a cavity. So when you have the effusive form, you get what's called a fibronecrotic inflammation in the abdomen. Well, fibro is almost like scar tissue. And necrotic means it's killing tissues. So what happens is the fibrosis that happens in the abdomen will actually start to necrose the fat in the abdomen, the connective tissue, the omentum. So fibronecrosis or fibronecrotic inflammation is an inflammation that will kind of start to damage the tissues in the abdomen. And when you have dead area of tissue, it actually can become infected, and that's what turns into a peritonitis, because when tissue dies in the abdomen, it releases bacteria, and then the body produces fluid to try and fight it, and white blood cells, and that causes this buildup of fluid. That's what we're getting to here. And it can start to get clots, which causes abnormal blood flow, which worsens the effusion. And so you tend to get fluid in the abdomen. I mean, when I've seen an FIP cat, they look like they have this little chest and they have this huge belly. And the difference is when you push the belly, it's not tight like gas, it's squishy like fluid. Their whole belly is full of fluid. So if you have this older cat that starts acting strange and it comes in with this really swollen belly, a lot of us are thinking, could this cat have FIP? It's kind of like one of the common clinical signs that, that's what I think of. FIP, infectious peritonitis, swollen belly, full of fluid, And again, that fluid is part of this peritonitis process that's going on with the virus. Initially, and it can progress to the thorax, not always. Sometimes it's just in the abdomen, but it can cause a pleural effusion, which is fluid building up in the thorax around the lungs. Remember, it's not in the tissues, it's not in the lungs, it's the space around the lungs. That's what an effusion is. So initially they're not too sick, but it can produce ascites. The first blank here should be ascites, A-S-C-I-T-I-E-S. And ascites is another way to say abdominal effusion. Ascites is a buildup of fluid in the abdomen. So whenever you hear ascites, abdominal effusion, peritoneal effusion, they all mean the same thing. There's fluid in the abdomen around the organs, in the cavity. It can go to pleural effusion, so that's another one of the signs. The third blank here, so second, third, or down here would be anorexia, depression. So anorexia / depression. So not eating, lethargic. Yeah, Cassidy, I was going to talk about that. It's like when you pull off the fluid, you'll be amazed at how much fluid their belly can hold. I mean, I remember this old gray and white cat, and he was all very majestic looking, but he had this really skinny chest, and when we held him up, he had this like huge abdomen. And when the doctor pulled the fluid off, I mean, we had like one of these buckets was like a liter. I think we got like, yeah, close to 2 liters, 2 of those buckets. It's crazy how much fluid they have. Another line here would be weight loss and dehydration. So because they're not eating, they're depressed, you get weight loss, dehydration. And then the last would be febrile. So I'll say that again: ascites, pleural effusion, anorexia / depression, weight loss, dehydration, and then febrile. So sometimes they were going to have a fever. Now what happens is, and there's a note right here, is that eventually the abdomen is so big that fluid pushes on the diaphragm. So sometimes they come in because they're having a difficulty breathing. Now, they could have a difficulty breathing because there is fluid in the thorax, but sometimes the difficulty breathing is just the weight of the fluid pushing on the diaphragm. And so, when they try to constrict the diaphragm, there's so much fluid, it doesn't allow the diaphragm to move freely. Therefore, they don't take as good of a breath, and therefore that leads to kind of the respiratory effects. Now, that's probably the most common. I mean, I feel like if you're going to see FIP, you're usually going to see the wet form. There is a dry, which is called non-effusive. Now, if it's non-effusive, it doesn't produce fluid. Fluid is wet. No fluid is dry. So the dry is a non-effusive FIP. And that's not as common. As far as signs, this first blank should say anorexia. You can have pyogranulomas. Now what happens, what a pyogranuloma is, it's a growth that can form like in the tissues. Usually we think about the tissues in the abdomen, and it can have some pus. Pyo means pus. Granuloma is like when tissue kind of overgrows or granulates. So a pyogranuloma is kind of like a growth, and it can be found sometimes in the tissues in the intestine and whatnot. Weight loss, dehydration, and fever. So again, those are very vague symptoms. So diagnosis is, there's lots of different things we can do, but you're typically going to try to do your CBC chem, but the key test is the abdominocentesis, which anytime an animal has fluid on the abdomen, you put a needle in and you take some of that fluid out. And immediately when you look at it, the doctor is already starting to assess it, but it's going to it's going to be more yellow and a little bit more thick. Now, normal abdominal fluid should be very serous or watery. It barely has a color, maybe like a light straw, very, very, very light beige. It's hard to explain. So any other color than that is indicative of something. So, and again, if it's thicker. So a lot of times the doctor usually has me spin the fluid, and I spin it down and I look, it could clot because it's thick. It usually has a high specific gravity because it has cells in it. So the more cells will increase that specific gravity, and usually has a high protein content. A lot of inflammatory cells in the fluid, which would be like neutrophils and such. Now, the urinalysis, they may have a proteinuria, which normally they shouldn't be having protein in the urine. And they could have bilirubin because of the effect on the muscle tissue and the effect on the body. Now, if you do an ultrasound or a radiograph is probably going to show just fluid on the abdomen. So the abdomen kind of looks cloudy. Sometimes it's hard to see organs because the fluid's thick and it makes the abdomen look gray. So you don't get that detail, that change in detail. Organomegaly, it just makes, and that, yep, you're good. Let me just explain that and I'll stop there because I don't really want to, this is good stuff to talk about, but organomegaly just means the organs in the abdomen look large. Because of inflammation, the liver might be enlarged, the spleen might be enlarged. And so everything just measures. When you do an ultrasound, you measure the size of the organs. And if they're abnormally large, that's called organomegaly. And that can be indicative of this. Let me stop there. I will do the rest of the blanks tomorrow. We'll finish with the end of FIP, and then we'll do FIV and feluke. And we should be able to get to, I know it looks like there's a lot, but I think we'll be able to get through that tomorrow. So I'll finish the blanks tomorrow. Do you have any questions?